I'll never forget the first time I had someone who reached out to me on Facebook. And it was the day before Christmas Eve. And he emails me and he said, I never watched the channel that you were on today, but I saw your story and I just wanted to share that I was planning on killing myself the day after Christmas. And after seeing your story, after hearing your message, I feel like I can go seek help. I can go seek treatment now and I actually want to live. So thank you for sharing your story. You never know who might be thinking about suicide. You don't know who's really depressed. I always had a mask on my face, acting like I was really happy, that I was bubbly, that everything was perfectly fine. So from the outside, it did look great, being able to have a great family, being able to go to a great school. But internally, that's not how I felt. There was just something in my brain saying, I don't belong here anymore. So I attempted to take my own life by going out of my 9-story bedroom window. Devastating injuries. Was in the hospital and was given less than 24 hours to live, 48 hours, and then given a 40% chance to live, induced into a coma for 5 days, in the ICU for 2 weeks. And I woke up in this hospital not knowing why I was there, because to this day I don't remember going out my window. My first initial thought was there's no way that I could survive a 9-story fall. I knew physically I would never be the same. That was the toughest thing, was laying in this hospital bed and I was told that I'd never be able to get out of a hospital bed, that I would never be able to get into a wheelchair, let alone be able to walk. So I had to accept, one, that yes, I attempted suicide, but two, that physically my life would never be the same again.
Instead of the leg being back and along with his body, he's stuck here.
I figured that by telling my story enough that it would break the stigma surrounding it, and I think that's how we break the stigma of mental health and suicide prevention, is if people are able to tell their stories, if people are able to say this is how it affects me, it normalizes being able to have that conversation, and I honestly think that's how we break stigma surrounding it. I'm an 18-year-old senior in high school. I'm down to 80 pounds. I can't move, I can't talk. I'm full-time public speaker on mental health and suicide prevention. So I have the opportunity to go around the country to speak to young adults in middle schools, high school, colleges, people of all ages, talking about not just my story, but really mental health awareness. And so I've been doing that now for the last 8 years, almost 9 years now. I've spoken to ages as young as 4 or 5th graders, but also been able to speak to college students, been able to speak to professionals, being able to speak to all ages. Students' reaction is, one, it's almost kind of a deep breath and they're like, finally someone said it. Finally someone said how I felt at this age. Finally someone is saying what we're all thinking and what we're all going through, but no one wants to speak on it. Finally someone is getting that out. It's unfortunate that some school districts have the mindset of, it's not our students. Our students aren't going to go through this, maybe feeling depressed or even thinking about suicide. And it's unfortunate that a lot of times it takes tragedies for these schools to open up and to wake up and saying, oh, our kids do need to hear this message. It's not out of the ordinary for someone to be thinking about suicide or to have those thoughts of not wanting to be here. So I always hope by me being honest about the things that I still deal with to this day, that it opens up someone to share what they might be going through or what they might feel at that time. It is just amazing. It's a miracle that people do not take their own life because of hearing a presentation or a story like mine. There are times where I'm done speaking and I go back to my hotel room and I say, I'm really damn lucky to have this job and to have this opportunity and to, plant a seed of talking about mental health and seeing that grow throughout the time I'm in there for a short period of time, seeing students talk to each other and hug each other and finally talk about what they may be going through. I never shared my story wanting to be famous or wanting to seek attention or be on TV and magazines. I told my story because I figured this might help someone else.